Hey, this is Dr. Jason Tirado, your West New York chiropractor, and today's Whiplash Alert, we're talking about how whiplash actually affects the ligaments inside your neck. You know, most people who usually get some type of a whiplash accident or a whiplash type of injury, they think it's a problem that happens inside their muscles, right? You know, and it's really easy to understand why, because obviously when you get into a car accident, your neck is killing you. Your neck is really, it's in a lot of pain, right? It's extremely common. You know, sometimes they'll get deep pain. They'll even get a lot of muscle spasm following really bad car accidents or even minor fender benders. And since our head is about 10 to maybe 15 pounds, it's also attached to our necks, right? So, and a lot of these muscles that are inside there actually go to the shoulder region. And so whiplash can actually cause or feel like a muscle pull inside here. And because people end up with a lot of muscle spasm, they end up taking things like muscle relaxers. And that just seems reasonable to take a whole bunch of medicine, a lot of pain meds, and a lot of muscle relaxers because they've got this muscle spasm. But you see, although the muscles do get spasmed and there are these muscle tears in a lot of the muscle fibers, that does occur, these can actually heal really, really quick due to having like a really, really heavy blood supply. But the ligaments, such as the discs inside the spine or the discs that hold the joints of the neck together, these things that keep the nerves from being pressed upon and being squeezed and stretched. And these are the structures that are actually critically injured during some type of a whiplash neck injury, right? And it's these muscles that actually contract to protect the joints of the neck from moving too much. These are generally less of a problem than when something like the ligaments are actually injured, right? So a recent study actually showed that after a whiplash accident occurs, right, the strength of the neck of the ligaments is completely reduced. This means that you're actually more susceptible to getting injured if you previously had some type of trauma to your neck, right? Which means it's like an eggshell. It's an eggshell theory, right? Meaning if you've already had this problem inside your neck where the muscles have been torn or the ligaments have been weakened, if you get into another car accident or a small little fender bender, the damage to your neck can actually be doubled. So to detect a lot of these ligament tears inside your neck, you've got to look at MRIs almost immediately after a car accident, which is why a lot of chiropractors, a lot of doctors send their patients to go get an MRI almost immediately, right? Unless, a lot of insurance companies, they want you to wait several weeks, 4, 5, 6, sometimes even 8 weeks, and it's important sometimes to go right away, right? In many cases, whenever you take an MRI of almost immediately after a car accident, it'll show the whiplash problem, it'll show the whiplash injury, and it'll show small tears or even inflammation and swelling inside the tissues of the discs, right? And a lot of these ligaments and the important structures, right? Another thing you could also do is you can take stress x-rays. These are x-rays where your head is in the position of forward like this or backwards like this. These are movement x-rays, right, with your head bending. And it's these types of x-rays that can actually show which ligaments inside the neck have actually been injured in the first place, right? And it also shows, what vertebrae inside the neck might be moving either too much or maybe even too little as a result of this trauma, of this car accident. So when there's increased motion inside the neck, well, that's severe. That could actually be known as something called instability. Instability inside the neck can cause very, very serious problems. And some of these newer MRI machines, make sure you go to a newer MRI machine, not an older MRI machine. Well, they can scan the neck in different positions also, right? So it can actually show all these tears that might be taking place inside the neck. Some people might find that an MRI scan may be a little bit more restrictive, and they might even be claustrophobic when they go inside these MRIs. But it's really, really important to be patient and to actually let these MRIs take really close, clear pictures of what's going on inside your neck so that you can see the types of injuries that are going on inside there. And many times these hidden injuries can actually be really, really big injuries. X-rays are also usually the most practical and the least costly, right? And you can always take that as a standard, but it's really important to get a better picture to make a proper diagnosis, and that's why the MRI is usually necessary. That's about it for today for your Whiplash Alert. I'm Dr. Jason Tirado, your West New York chiropractor. If you've got a whiplash injury or a neck injury, come and see me real soon. Take care.